I would not do medicine. I'd rather do dentistry. Well, we do talk about the Ted Bundy case a bit. Netflix released documentaries and a movie with Zac Efron on Ted Bundy. There are a lot of children who do not have care, or their parents are not aware of how important dental care is, from a young age.
Thank you so much for coming in, Dr. Lewis, and joining us today. How are you?
Thank you. Thank you for inviting me.
Yes, yes. I'm glad that you came in. So tell me what got you into dentistry.
So for me, when I was younger, I always wanted to, become a doc. I was interested in medicine. I used to watch this program called Saint Elsewhere. I don't know if you know that. It was
Yeah,
back in the 80s.
yes.
So growing up, I used to watch that program, and I just loved the premise of the show and all the characters in the show. So as a young kid, I used to always think, oh, I want to be one of them, and be a doctor. And then my father was very encouraging about it. So that was where my mind was set as to become a doctor one day or a physician. And then towards the later part of high school, I just decided there were a lot of factors behind the scenes. And then I decided I would not do medicine. I'd rather do dentistry.
Mm,
And so I did that switch, which I don't regret. I mean, I think I'm also fine if I would have liked to have done medicine, but dentistry has given me its own gratification in its own way. So that switch was, it was a good switch, and I think what was meant to be happened. So I'm grateful for that.
great, great. So when you say a certain type of gratification, what type of gratification are we speaking of when you think of dentistry?
Like, I mean, like in the sense of the kind of work that I do, kind of communities I serve, because I feel like, when I was younger, after, when I had a kid and everything, that, I wasn't as, I think if I'd gone into medicine, I would have gone into a more intense field and a specialty. And I feel with dentistry, I didn't have to do that. It was more, I think it blended much more better with my personality and what I wanted with a work-life balance.
Mhm.
So, and with the work part, it was easier for me to do the kind of work I wanted, like whether it was in public health, pediatrics, where I didn't have to compromise in any other part of my life. I think I would have still done that if I'd done medicine. There are ways to do it. I'm not trying to say medicine cannot do that. It's just for me personally, that's what worked.
Mhm. So you
Yeah.
found yourself from the start, you were dealing with particularly looking at um, pediatric dentistry. You were doing a
Yes.
little bit of that.
Yeah.
But how long did that go?
Well, I did a residency in pediatric dentistry.
Mhm.
And so that went on. I mean, well, went on meaning it was a 2-year
Okay.
residency and a year and a half of a master's in public health. So that was my initiation, especially once I moved to the US. I did my undergrad in, well, pre-doc, dental degree in India.
Okay.
That's where I'm from originally.
Yes.
So and then when I moved to the US, I studied at Boston University in Boston, Massachusetts.
Hmm.
So, so in other words, that's where my pediatric training started. And after that, I tend to be more focused in pediatric treatment.
Hmm.
Though, I also work with adults, but our adult dentistry where I'm at right now. But yes, pediatrics. And then later on in my career, I got accepted into a fellowship in forensic dentistry and or it's called forensic odontology. And so I started with that. And then I've ever since that, I've been also delved into forensic dentistry as a more pro bono part of my career.
Oh, that's interesting. Pay for your schooling for forensics. and you took it and you use it all over the world. Is that correct?
No, no. Forensic was just a choice later on. I was always interested in forensic dentistry.
Okay.
So it just came up. There was an opportunity that I came across that there was a fellowship program, which was a 2-year program.
Okay.
And so I decided to go ahead and do it because I had an interest in the field.
Okay.
So, and that's how I got into it. So, I did the program, and then after that, I started to do little, to work here and there in uh, local county examiners' offices, as well as, COVID happened and online through some cases that I came across. Oops, sorry.
Oh,
That's my
good.
computer. Yeah, so I started to do that. Mm, and so that's what I've been doing, like, overlooking or uh, s- working on cases that with other forensic odontologists.
So, to tell me a little bit about forensic odontology, what is that? And how is it? Is it something? When I think of forensics, I think of some type of uh, criminal aspect to it. I tied forensics into that, but I'm sure that's not just that,
Yeah,
if any. But
yeah.
what is forensic odontology?
So forensic odontology is really like a science that delves into, of science and dentistry that involves looking into criminal and civil cases. So, like I always tell people who ask me about my field, I say it's not always about the deceased or dead people. It's also about people who are living. Sometimes they're missing, they need to be identified, or there's been a human or natural calamity, and sometimes people, so either they're deceased or they've lost their memory, or there's some civil cases or criminal cases where they are living individuals and they don't want to be identified, or they're a perpetrator. They're living, they're a criminal, and so there are ways to identify them or help the judicial system on a whole to be part of solving a case. But it's a part of the puzzle. It's not the whole puzzle, but it's usually a piece of the puzzle. It can be a contributing factor. So basically, what I'm trying to say is we work with individuals who are living and deceased.
Okay. Does it have anything to do with disease or where it all started, originated, or anything like that?
Like a health, like a disease of an individual.
Yeah, that might be in the mouth that you can't really see. You have to go deeper, dig deeper for some reason. I don't know. Is that
Well,
part?
there is forensic pathology. Yes, there is. Like when you have a person who has passed away and you want to figure out how did they pass away.
Hmm.
There is something called forensic pathology,
Hmm.
uh, forensic oral pathology. And in those situations, you look for signs of what could have happened in this individual that led to their death, or sometimes in sexual abuse cases or any kind of cases that involved rapes, and so there's some level of pathology or disease that comes into play that helps make some kind of connection to who was abused, who could have been the abuser. So in that case, disease, back to your question, does come into play.
That's interesting. So you actually get into the DNA
Yes,
of
DNA is involved, yes.
yeah, interesting. Quite interesting. And
Mhm.
you're taking this all over the world. You've gone from, from the States, to, places across the globe. Can you talk about some of those experiences?
So from that perspective, I've usually lectured or observed cases from people across the world. I get on like Zoom calls and where we talk about cases or how somewhere across the world they handled a certain situation,
Mhm.
whether it was in living individuals or deceased. And um, and then we've given lectures. I'm part of a board member of an international forensic group. So that's how we exchange information as to, okay, in Italy, how do y'all do things versus in the US, how do we do things versus in India, how? So that's, exchange of knowledge, and you take what you can and use it how you can in the country you live in or in the country you're helping with, because of course, all countries are different. And so that's been my role, like, learning from others as well as them learning from what we do here in the US. And now, and also we discuss cases, like how did you all handle this? What is the judicial system in that country there and we have to look into something here if, it's applicable. So from that angle, yes, we do. And I do look at cases, yes.
Oh, that's yeah, okay. So now that kind of moves me into the question of what you're doing at Texas School of Dentistry.
So
Yeah,
Texas A&M University,
yes,
yes.
yes.
There I'm faculty. I'm a clinical associate professor.
Mhm.
I've been at A&M, Texas A&M, for the last 15 years.
Oh, wow.
I teach clinical and laboratory lab dentistry, as well as I teach lectures in comprehensive dentistry as well as in forensic dentistry. So I introduce our students to the concept of what's forensic dentistry and their role as dentists when they graduate in the world, really, or in the clinical area, because the role that they play, even if they don't delve into forensic dentistry, but how important their treatment and how important the information they collect on a patient is important in case something did happen to that patient, in case, the person went missing or died or ended up being a criminal. So it's how the information we collect as dentists is really important. So I teach courses on that and how to record and document information.
And you've been doing it for 15 years, I'm sure. You must have,
I'm teaching for 15 years for the forensic part. I've been teaching that actively for the past 7 years.
wow, that's quite a bit of time you've been spending in academia. When you present to your students, I mean, do you find yourself presenting serious problems for them and then even something that might encourage you to even do a deeper dive for your own um, clarity, if you will, of what you're going to present for the students in a particular session or sessions?
You mean from a forensic aspect?
Yes.
Yeah, like we discuss cases. We discuss cases which have been nationally known, like Ted Bundy, for example.
Oh, yeah.
Or we discuss cases that may have been in the news in the past 5 years that our students, because they know the latest news. And
Yeah.
so going 25 years ago, and our student pool is between ages 20 to 30, most of the class, so we discuss cases that have been in the news in the past 5 years. So that gets them interested. And like we talk about, like, especially if there was a forensic dental aspect to it, I bring that up and expose to them, this is what happened. This is what happened behind the scenes. And even if it was a case they weren't exposed to in the news, if I come aware of it, I'm aware of a case, I will show them or talk to them as much as I can. A lot of these cases we cannot talk in
Discuss.
public. So unless I get permission or consent to use it as a teaching purposes, of course, without divulging any names or anything. Um, yeah. So we talk about that. So it's from a case by case basis, and So, and also to let them realize that what they will do as dentists, how important the information they record is important for future investigations or future situations that may arise in their patients' lives.
Yeah, I'm wondering too. I mean, is there like any particular forensic case that kind of like really caught your eye that you wanted to teach to the students?
Well, we do talk about the Ted Bundy case a bit because they if they because they're younger, like people my age and older, all know about Ted Bundy, but not everyone in the 20 to 30 age group do. But then they also do happen to know about him because of Netflix released documentaries and a movie with Zac Efron on Ted Bundy, and all our, the younger, the next generation might does know of the actor, do know of the actor Zac Efron, and then they know his movies, and then so when Netflix released the movie and then the documentary, so they know, oh, that's the case, the movie that Zac Efron acted in, and so they know the case. So then it's easier to discuss it with them, and then if they're more interested, they've gone and looked at documentaries or YouTube videos, and then we of course discuss the case. Uh,
Mm,
but that's just one example, though. That's because that's a much older case. But like in the recent years, like Gabby Petito, I think the last name was Petito, the lady who's allegedly her husband murdered her somewhere in, I think it was Colorado. I'm not sure right now. But then how the remains were found, how they recognized the remains to be her, and then how they identified her husband's remains. So, and part of the identification of both their remains was through dental identification, you
mm.
know, because by the time they were found, their body had, of course, decomposed. And so we talk about that, situations like that. And then to make sure it was her and her husband, then they have to compare dental records, which is called the antemortem records and the postmortem. Postmortem is obviously when they have died, and antemortem is the records that they collect from their dentist to make sure it is the same person. So we talk about cases like that.
I'm trying to figure out too, Dr. Lewis, so what makes forensic odontology so like such a deeper dive than what it is, what a general dentist would do? I mean, what makes it different?
Oh, it's a subspecialty in certain ways, it's like a general dentist can also be a forensic dentist. I mean, it's good to have that extra training though, because there are parts of forensic dentistry, it would be great to have certain extra training. But to your question, is your question like what makes it different from general dentistry?
Yes.
So, and it's the easiest way to explain that would be to say that forensic dentistry is more of trying to solve a puzzle, while general dentistry is you're treating the patient, right?
Hmm.
Trying to help them to keep their mouth healthy or get them out of pain. In
Hmm.
this situation, in forensic dentistry, is more working with the judicial system or helping the judicial system in trying to figure out a case, to solve a case, or even trying to help, if someone goes missing, how to help identify them. It doesn't always have to be the judicial system. It's basically your community. Like if there was a calamity, how to help identify them. A dentist can step in when they say, "Hey, hello, this is the person that we are looking for. These are his dental records that we have of now. Can you look at your dental records and can you verify if this could be the same person? So it's like helping doing like your civil duty
Sure.
and maybe judicial duty if necessary, if it goes to that level. So that's what the forensic part is.
Mm.
Um, you're helping that aspect. And general dentistry is, just like how a physician takes care of, helps you take care of your body and helps you solve issues you may have. Same thing with dentistry. It's taking care of that, like you as an individual. But forensics is more solving a problem.
So when you say solving a problem, you saying different puzzle pieces. Are there any dental puzzle pieces that you can talk about that involves forensic odontology?
Yes, like, we look at the teeth, how the structures of the teeth are, how many teeth the person had when they were deceased versus when they're living, or even both cases when they're living. Like say if there was an individual who was trying to pretend he or she wasn't who they actually are, we look at teeth, unless they've gotten some extensive work done and try to claim to be someone else, we look at teeth and we look and decide and look to see, okay, this person is lying or this person is telling the truth, that he is who he says he is or she is who she says she is. So we look at structures in the mouth. We look at facial, like from a forensic dental aspect, we look at facial aspects, which there are other forensic specialties who do that too, especially at facial profiling and everything. But we are more into just the oral cavity. That doesn't mean we don't look at facial profile. We do. We look at that. We look at anthropology aspects of how the human body is and what clues we can get from that individual to verify who they are and mm, what their role is in the situation that we've all been put in, look made to identify. Yeah.
Okay. Okay. So over your tenure of 7 years of forensics on odontology, um, you have seen quite a bit in 7 years, I'm sure. I'm wondering, how has the technology changed from the 7 years up to today? Is it something that you open up with you accept with open arms, or has it been somewhat of a challenge?
I think it has gone in for the better because, even in forensics, whether it's forensics, pediatrics, public health, things have, we're looking into more, we have more technology comes in to help us get more strict about how the way we look at things. We can't just make assumptions or we can't just come to a conclusion based on like, oh well, this is how I know it should must have happened. Now we have to show scientific principles. We have AI even, right? That sometimes now I mean, it's new, I would say relatively. We still need humans to make that final conclusion, but AI and other technologies help us to, and science, basically science does help us to make that decision, that firm decision that, okay, this is the perpetrator, or this is the tooth, or this is how I will treat the, the tooth. So, because technology has exposed us to, more aspects, like when you take an X-ray, maybe a two-dimensional image. Now we can look at a tooth from a three-dimensional aspect, right? So than we did maybe 7 years ago. So technology has really helped in that way. And so there's less room for error and more room for, I'm not going to say perfect treatment, but perfect, as perfect as we can get as a human. So technology has been an asset. And like AI is playing, you know, I don't know enough to comment that it is everything, but it is something. It is helping us a lot with even from what I've seen or heard of diagnosis, you know. So I think it's been a good thing.
Awesome, awesome. I see. And so, um, when you think about, um, well, when I think about, um, as I mentioned earlier, as I think about forensics, I think about, something that has to go to court. I just thought that was just so interesting. And I thank you so much for sharing that with us. Tell us about some of the pro bono work that you've been involved in your public health mission.
So the pro bono work is mostly, when we do public health work where we do screenings or any kind of work that helps our community. But my specific pro bono work has mostly been in forensic dentistry, where I help with looking into cases or helping identify cases and constructing reports. So that has been mine. From a public health standpoint, I've been involved in different organizations which help at a state level sometimes, or and then we look into policy changes. So that's the part where you don't always, you either don't get paid or you get paid really minimal to work on these, because we need to have our government or our states or counties know, legislators know, hey, our the people in our community need X, Y, and Z, whether it's fluoride, whether it's Medicaid, Medicare issues. So that's where there's those of us in public health, we try to create an impact. And I have a bunch of good colleagues, that within A&M and outside of A&M and within the state of Texas and nationally, that we work together. And we don't always necessarily always get paid for some of the stuff we do. That's what I mean by pro bono there.
Yes,
But we still do it because that's our role as public health dentists, and there are a lot of non-public health dentists who also do it. But that's what pro bono means to me. And when it comes to forensics, a lot of times, unless you're working for a county examiner's office or for the state, like as a federal hire, I mean, or for the federal government as a federal hire, or a state government for a state hire, you don't get paid. And so, and but this is my sense of being part of a community to help solve issues or deal with cases that need to be solved. So you're really working to help your judicial community, from that angle.
that is wonderful. Is there other areas that you feel just as passionate about, or
Well, pediatrics for me, because I feel like pediatric dentistry, and I'm passionate about geriatric dentistry, but I haven't been in the field as much. I always I have a few colleagues who are involved in geriatric dentistry, and my training isn't as in depth as theirs. Maybe hopefully in the future I will be able to contribute more. But I was trained in pediatric dentistry, and from that angle, like even in the US, there are a lot of children who do not have care, or the parents are not aware of how important dental care is, from a young age. And so that's part of my community health services, like, speaking in situations, maybe like, something like this, to encourage parents to say, I mean, parents are much better than maybe when I was growing up. Like, they didn't think of like, oh, the baby teeth, not that really that important. They're going to get the new ones. But now I think parents are becoming more aware. But even if parents are more aware, they may not have access to care. And so that's where I'm passionate about pediatric dentistry, is to look and see, hey, how can we get all these children, and how can we make parents more aware that, hey, those little baby teeth are just important. And there's a science behind it. It's not that we're just trying to encourage people to go to the dentist or the pediatric dentist. There's a science behind it, the infection it can cause, how it can affect their future adult teeth, right? or permanent teeth. So I think that's my passion about how to promote these issues and helping people step away and think about that, you know, prevention of any kind of dental issues helps your whole body heal.
Yes.
Because when you have, all the unhealthy bacteria in your mouth, they can affect your brain, your heart, your lungs, your kidneys. And these are studies that have come out in the last 10 years. When I went to dental school, nobody taught us that. But in
Mm.
the last 10 years, we've become more aware. We even teach this in the dental school. Whatever is happening in your oral cavity is affecting your systemic health.
Mhm.
So, and that's what we try to get patients to understand too, that even if you don't have cavities, even if you don't have, bone disease or whatever, periodontal bone disease in your mouth, go to the dentist once a year to at least just check up to make sure there's nothing else happening, right? So that we can keep the healthy bacteria in your mouth thriving and prevent the bad bacteria from multiplying.
Yeah.
So,
Yeah. 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 So that's another like we are the Wealthy Dentist podcast, but when we think of health, uh, the health goes right with it, right?
yeah, yeah, yeah,
Yeah.
exactly.
Go ahead.
And
I'm sorry.
I think like a lot of now in the healthcare industry, it's not just dentistry, it's all about prevention too. What can you prevent? What can you do now to prevent your systemic health from going bad or your oral health? So what are the options out there? So I think that's what we're trying to promote. And that's what a lot of public health dentistry tries to do too. Like, everyone nowadays in the last, especially 5 years or so or more, have been talking about Alzheimer's and
Mhm.
dementia, right? It's not like it didn't exist before, but now we're diagnosing. We're
Right.
trying to figure out how to treat it or slow the progress. And one of the things where dentistry plays a role is there's been studies that found that the bad bacteria in your mouth can affect your brain and increase the progression of towards dementia and long-term Alzheimer's. So
Interesting.
that's what we try to tell our patients. Like,
Mm.
listen, we try to have to take control over our oral cavity. So now, is it you may have an inclination towards developing it, but then we can slow the progress and we can think of ways how we can prevent it from happening. So that's the whole point. Prevention is hopefully what the next 20 to 50 years will be about in healthcare.
Mm.
Hopefully.
Yeah. Well, I think you all already said it, but I'm going to ask anyway. If you had an opportunity to wave a magic wand within the dental industry to change one thing, what would that be?
One thing that I would like to change in the dental world.
Yes.
Oh, the one thing, if it was from a dental world, and if it was about teaching or whether even practicing in dentistry, it would be about prevention.
Mm.
Because we are always taught to treat the problem, not to prevent the problem. So
Mm.
I'm hoping that as we have our new graduates and even already graduated, that we look into more as our patients come in to talk to them about how to prevent problems rather than future problems than just to treat it, because we're not here just to treat your pain. We can help you prevent yourself from getting into a pain quotient. So that would be my hope that, as healthcare providers, that we would look into prevention from a larger angle.
Mhm. To contact you and talk to you more about forensic pediatric dentistry, I mean, how would they get in touch with you?
Oh, LinkedIn would be the best bet.
Okay.
If you look on for me under Shirley Lewis,
Okay.
and if they're connected to you, I think you and I are connected, so
Yes.
they can through there would be, and then I am also, on the Texas A&M Dental School website. If they looked up my name, they can send me an email. Email is always the best for me to reach out, and then LinkedIn, of course.
And what email would that be?
The email would be S as in Sam, and then Lewis, Lewis at tamu.edu. That's Texas A&M University.edu.
Oh, excellent, excellent. Thank
Yeah.
you again so much for taking the time. I'm sure people are going to appreciate this.
No, you're welcome. And thank you for inviting me and letting me talk about things that I'm passionate about, including, prevention and forensic dentistry and pediatrics. So I appreciate the opportunity to do this.
My pleasure.
The Wealthy Dentist podcast is built on connections, opportunities, and meaningful conversations that help jumpstart careers and boost the ROI on your business. Is there a topic you're passionate about or someone in the dental community who should share their story with us? We want to hear from you. Email your suggestions to the Wealthy Dentist Podcast at gmail.com, and let's create content that informs, inspires, and uplifts the dental world. Your ideas could spark our next big conversation. Let's make it happen. I'm Ward Powell, your host at the Wealthy Dentist Podcast, thanking you for being a part of our journey.